How many of you have experienced pain? Imagine the worst pain that will not go away no matter what you try. This is why some believe in assisted suicide. Assisted suicide is when a person is in a lot of pain and suffering, or they have an incurable disease, and they ask their physician to give them prescribed medication that they can take to die on their own terms. Currently, in most states, assisted suicide is illegal. However, assisted suicide should be legal. Today, I will discuss what assisted suicide is, a patient's right to die, and other countries' laws in favor of assisted suicide. To begin, you must know what assisted suicide is. According to Mayo Clinic, assisted suicide means another person providing the means or assisting someone with self-killing. With assisted suicide, you are not the one performing the action for someone else. You simply give them what they need or be in the room with them so they're not alone. It is not to be confused with euthanasia. While many places that allow assisted suicide also allow euthanasia, they are two different things. Euthanasia is performing the act of taking someone's life. Not all places allow both, but many places in Europe do. Now that you know what assisted suicide is, next, I would like to explain some rights a patient has that can relate to assisted suicide. Starting off with the idea of patient autonomy. According to HarvardHealth.com, patient autonomy, the right of patient to make decisions about their medical care without their healthcare provider trying to influence the decision. A person's autonomy is a right that everyone gets. This autonomy is also a factor that should be considered when thinking about someone wanting to end their life due to medical factors. If a person wishes to no longer live, that is, according to autonomy, their right. If a person wants help to die from their physician, then they should be able to get what they need to die without it being painful or illegal. Another right that patients have is the right to refuse medical treatment. This is established by the 14th Amendment Due Process Clause. If you refuse medical treatment, depending on how severe it is, you could die. This can be interpreted as a patient's right to die and how they die. Imagine you are terminally ill, but the doctor is still giving you medicine and trying to keep you alive, even though you both know nothing is working. Would you want to die on your own terms? Or would you want to die knowing it was your choice? After looking at what assisted suicide is and what rights patients have to make this decision, we can look at multiple countries and some states that have already started passing legislation making assisted suicide legal. According to Annals of Palliative Medicine, which is a site where highly researched journals are posted about palliative medicine. The Netherlands since 2002, Belgium since 2002, Luxembourg since 2009, Colombia since 2015, Canada since 2016, Victoria since 2017, and Western Australia since 2019. This is 7 countries that have laws currently passed allowing assisted suicide. Each of these countries have different laws, but with similar requirements, such as the patient must be of sound and clear mind, a minimum age restriction, a serious and incurable condition, and be an unbearable physical and psychological suffering, to name a few. There are other countries that have legislation in the works to legalize assisted suicide, such as Spain, Portugal, and New Zealand. Currently, 9 U.S. states have laws that legalize assisted suicide, including Oregon, Death with Dignity Act 1997, Washington with Death with Dignity Act 2009, Montana Supreme Court rule in 2009, Vermont, California, Colorado, District of Columbia, Hawaii, Maine, New Jersey. Seeing as so many states and countries legalize assisted suicide, doesn't it seem possible for more places to? In counter to legalizing assisted suicide, one could use the oath that many doctors take once they graduate medical school, also known as the Hippocratic Oath. One section of the oath states, "I will not give a lethal drug to anyone if I am asked, nor will I advise such a plan." This part of the oath means to not take or have a hand in taking someone's life, even if they are asked to. However, you must understand that this oath was in ancient Greece. This was a time when many people were very religious and their gods did not believe in suicide. In today's world, we no longer scrutinize people for committing suicide. We look to understand why they felt that they needed to and empathize with them. We empathize with those that are terminally ill, and most people today would understand them wanting to take their life on their own terms. In conclusion, assisted suicide should be legalized. I defined what assisted suicide is and gave reasons why it should be legalized, such as patients' rights and the fact that many other countries are creating laws allowing assisted suicide. While there is an argument about the Hippocratic Oath that doctors take, we now have different morals and values, many not based on religion anymore. By following in the footsteps of other countries and knowing what rights we have to better help terminally ill patients choose how and when they want to die, instead of allowing the uncertainty of an illness, improves quality of life and could be what you need one day. Just because someone believes it's wrong doesn't mean someone else should suffer.